Hi, and welcome back to the Magic of Giving. We're learning all about the Mental Health Association of Central Florida. In this segment, we'll find out about the programs and services they provide the Central Florida community. Returning for this segment is Candace Crawford, President and CEO of the Mental Health Association of Central Florida. And joining us is Deanna Eubanks, Director of Case Management for The Outlook. Hi, ladies. Thank you so much for joining us today.
Thank you.
Thank you.
What types of programs does the Mental Health Association offer?
Well, we've been in existence, since 1948. So all of our programs have evolved with the times. And we think right now we have a really good array of programs to serve the community. One, of course, is the Outlook Clinic, which Deanna's going to talk a little bit more about. Another one is Orange You Happy, which is an anti-suicide, anti-depression program out in the community. And the Guardian Advocate program has been a very important program that we offer. We work with all the hospitals to provide volunteer, certified, trained guardian advocates to work with mental health patients. This is really something that only the Mental Health Association provides in Central Florida. And then we provide mental health called Mental Health Connections. And that really is a free service to anyone that calls us for us to get the information that we need to try to help them in resolving their issues as far as getting services in the community that meet their needs. We try to find and research. We don't just pass off information. We actually make the connection, come back to the caller and make sure that it works for them. So it's a very personal service that we provide. So we do an array of things for the community as mostly a volunteer organization with a small staff.
Now you take care of different types of people across our community. Is there any, is it just across everybody across the community, or is there a specific
Anybody.
type of, okay, anybody, okay.
Anybody that wants any information from us in any area. We actually people will call us for things that we don't even handle, but that's perfectly okay because we like to get people to the services they need, whether it's, they're out of food, they have a baby that's sick, whatever the case might be, they're welcome to call us. Usually we can find something to help them. We work with other community agencies because we're a collaborator. We like to work with everybody in the community and make things happen for people no matter what their need might be. So anybody can call us. You could be a patient with insurance but you're not really sure what you need. We help you to navigate that and figure out what it is you need and help direct you in that regard. Or it could be someone who's totally without insurance. They don't have any money. They may be homeless. They may be a veteran that really doesn't know who to call. We get them to the right place.
Okay. Deanna, can you tell us a little bit about what a client would experience during treatment?
Oh, certainly. When they come in, they are offered a therapist, one-on-one therapist. We have two full-time therapists, Tammy and Julie, as well as med manager, who is our nurse practitioner, Kevin, and they do a med intervention as well. Then they also are provided with group therapies. They have the opportunity to pay less for their prescriptions because we have resources out there that we use. We try to bring down the cost as much as possible, considering all of these patients are without insurance, and we're trying to keep them out of the hospital because that's where they mainly were seeking their mental health treatments.
Okay.
It's really important to understand that this is such a great opportunity, and Deanna can tell you, they assist these patients in finding the services they need, and with a partnership with Walgreens, that's really helped us in providing very minimal cost to patients. But overall, this has saved these patients. They would never be able to pay what it would have cost. And I think the last calculation, if Deanna would give that to you, is staggering.
Was over $200,000 a year that we have saved our patients. It's a large amount.
Yes.
Is there a story that sticks out in your mind?
We had a patient that I think really exemplifies what can happen when you do provide services. We had a patient that showed up at one of our hospitals, attempted suicide, no job, no money, no insurance. came to our clinic. We started treating him. Within 1 year, he had completely turned his life around. He'd gone back to work. He was able to actually enjoy his children. And a year and a half later, he now has his own business. Look at what we have saved, a whole family. But not only that, he's working and productive and happy. And he's willing to tell his story, and we have used his story a lot in the community to exemplify how important this clinic is to people that really can function, can have a happy life, can take care of their children. They just need some help. So now he's able to provide for his family. There isn't any greater satisfaction than seeing the turnaround in these patients.
Right. Well, and I was going to ask you, why can't you let the clinic door close? But you just answered my question. I mean, you're so vital to the community.
It is. I mean, we do know that what happens is patients end up going to our hospital's emergency room, and anxiety and depression presents itself almost as a heart attack. Patients go into the emergency room and they're having chest pains, they're having all kinds of issues that can appear to be something extraordinarily serious. Well, they have to go through all the testing to make sure that this patient, they don't know when they first come in that they're suffering from anxiety and depression. So they have to go through all this testing. Look at the cost of that, what it means to the hospitals and to the community for these patients that really have no way of paying for it. So they come to our clinic, we turn their lives around, they're not going to the emergency room, they're living productive lives.
Wow, so it sounds like there's a stigma attached almost with mental health.
Well, there is a stigma attached. It's very, very difficult for people. And because family members that are around a patient don't really understand what they're dealing with, they don't even recognize it as truly an illness. And so they will say things like, you know, you just need to get over it. You just need to be happy. Well, a patient with clinical depression can't just turn that off. And they do need a doctor. They do need assistance. And that's why it's so critical that these people that do not have the resources, they have to have some place to go.
Wow. Well, on that important note, thank you so much for being with us today. And it's important that we do get rid of those stigmas.
It really
in
is.
our community. And thank you so much, ladies, for being with us today.
Thank you.
Thank you.
We're going to take a short break, and when we return, we'll discuss how the community can help them reach their goals. We'll be back in a minute with more about the Mental Health Association of Central Florida. Good job. That was awesome.